Okay. So I live in rural Cornwall, and my internet is powered by sheep, and we had some problems before. So apologies if anything goes wrong. So do you want to go to the next slide, Mel? So really just the Plymouth Alliance, many of you will know, because many of you will have seen us talking about this or read the reports, explicitly was about incentivizing a human learning systems approach. Just to recap, this is a 10-year contract involving all substance misuse services and housing services that are contracted by the council. There are also defined offers and asks with other services, notably mental health. So it's a real attempt to work systemically. It also includes a wider group of 20 services. So they're either subcontracted by the Alliance or they're part of the wider system group that we run. All of the money is owned by the Alliance, so all of the spend of the CCG and Public Health and the Council was devolved into the Alliance and is owned by the Alliance, and commissioners are equal partners in the Alliance. So there's an Alliance leadership team of 10 people. There are 3 commissioners in that, and it's 1 person, 1 vote. So we can be outvoted by the providers, and we often are. But that's really, so I think we were in a slightly better position, I think, than some other places, because we had already been working on this. Do you want to go for the next slide, Mel? So an alliance is a type of contract. It's really a kind of legal partnership agreement. It's a vehicle to share risks and responsibilities. It's all about working based on alignment, common commitment, and it's a value-based contract. It's not itself a legal entity, so participants retain their own identity and internal controls. So it's a kind of hybrid between a kind of a merger situation and an individual services. But the reason we went for that was essentially to incentivize system working and cooperation over competition. Next slide, Mel. So this is a traditional contract, and if you click it again, Mel, there we go. There's an alliance contract. So, and again, click it again. There we go. So on the right-hand side, that's the way the alliance works. So essentially, there are all the providers and the commissioner are part of this collective. There is an external commissioner that we call the owning commissioner, but essentially their role is much more facilitative rather than performance management. One of the kind of key principles of the alliance and in setting up the alliance was to move away from RAG ratings and performance management. So we do still have outcomes that we treat as learning points, but we don't performance manage those outcome measures. They are really kind of system learning indicators for us. Next slide. So the world kind of BC, or before COVID, just as I was saying, really, that we were in a position where we were already explicitly focused on people, issues and systems rather than on service silos, and a focus on working relationally and behaving as a collective. We had done lots of prep around this. I mean, essentially we had a 5-year lead into before the alliance was awarded. The alliance was awarded a year ago. But really since last April, when the official contract was awarded, we've been doing lots of kind of collaborative building work. So lots of show and tell sessions between various staff groups and various services, lots of opportunities for people to shadow each other, lots of simplification of pathways, and lots of kind of integration of responses. Obviously, this is a 10-year contract, so we were kind of quite, this is a kind of a process to build on. We weren't kind of completely there, far from it. But we had developed several integrated programs and structures and some small prototypes around aspects of the work, notably one around vaping, where we gave a couple of months free vaping equipment and supplies to rough sleepers, an alcohol outreach program which was reducing frequent hospital admissions. but also rolling out appreciative inquiry. So for us, appreciative inquiry is a key tool in system change, and we've been training anybody who's interested, which is actually a surprisingly high number of people, how to do it. And then people have been using that to examine lots of issues in our system. Next slide, Mel. So yeah, there were lots of kind of small examples of this new integrated work. Some of that was kind of initiated by the leadership team, but probably the majority has come from bottom up as people have kind of got to know each other and through the kind of collaborative building processes we've had. We were seeing much more sharing of information and resource, although still some silo mentality. And our approach was fairly cautious because we don't want to rush it. We don't want to kind of railroad people. It's all about winning hearts and minds rather than imposing anything. So our approach was typically design a small prototype, test it, see what happens, gather the lessons, and then repeat that with new learning. A fairly incremental approach. We would see pockets of resistance. We did still see pockets of resistance. I really don't mean that negatively. I think it just reflects how highly affiliated people are with their services and the issues that they've kind of been working on for a number of years. And we very much didn't see that as a negative. We saw that as something, you know, our role as the leadership team was to try and build new affiliations by engaging people in the work. Next slide, Mel. So kind of after the plague started, what we saw is a really rapid and massive expansion of all of our kind of pilots and experiments into mainstream practice. So, for example, the vape, we're now giving out 280 free 3 months supplies of vapes to homeless people with COPD and other lung conditions. We have a managed alcohol project where we're allowing people to drink in hostels. We're going to the shops and buying their alcohol for them, and we're also buying alcohol and giving people alcohol that don't want to engage in treatment, really just to try and keep them safe and socially distanced. A huge amount of cross-agency collective work to quickly secure and furnish accommodation for all of our rough sleepers, which is a really amazing kind of heartwarming thing where everybody worked furiously to secure loads of kind of houses and flats and a whole range of things. And then we of course we couldn't furnish them, and the alliance manager put a tweet out, and we were overwhelmed with members of the public providing duvets and beds and chairs and all that kind of thing, so people could have their own accommodation. A really kind of heartening, because this is a very unpopular, typically unpopular group with the public. They were seen as unsympathetic, but actually the way the public and the community responded was amazing. We've kind of housed the previously unhousable. So all of our rough sleepers we housed in 6 days, and which has made all of us ask why we didn't do that before. And the other really interesting thing is the transfer of work online. And I'm not talking about us, people like us, and moving our meetings online. Our day service is running a daily relapse prevention group and some therapeutic groups, with 12 people attend that every day via Zoom, and 37 are attending a whole range of Zoom meetings delivering day centre interventions on a daily basis, which is kind of really not what we expected. Next slide, Mel. So some of the other things we've done, which have kind of led to some important lessons for us, is loosening governance in order to allow more flexible responses. It could be argued, I would certainly argue, that quite a lot of this has meant we now treat people as capacitated adults and partners, rather than people that need to be controlled or who we infantilize through governance. A really important thing for us has been kind of breaking out. So because we're doing lots of work with the hospital about discharges and the police and other kind of traditional parts of the council, people now really understand the contribution that drug and alcohol and housing services make in a city. And so for us, in terms of profile raising and understanding and engagement, it's been a wholly positive experience. We are suddenly visible and valued in a way we haven't been before. We are in a position now where we seem to be caring for more people with fewer staff, because we have, like everybody else, lots of our staff are isolating because they're symptomatic. And some groups are getting a better service than they've ever had. Arguably, some of the housing clients are certainly getting a better service than ever. And we're seeing staff working across agencies. So we were doing, as I said before, the shadowing and the show and tell, so people were spending bits of time in agencies, but now all of our staff are in a pool and they're all working in all agencies wherever the need is. We're beginning to see some of those staff who were previously highly affiliated with their own service beginning to see how their skill set, how their issues might be better applied in a different service or elsewhere in the system, which has been a really kind of interesting and unexpected development for us. Next slide, Mel. We had an Alliance leadership meeting on Tuesday, and I think everybody thinks everybody has been fundamentally changed by this in terms of how we see ourselves, our roles and our work. And what it's really done is expose how much effort in a system is to do with responding to organisational need rather than to real need, how much of our governance is really just routinized practice or serving the needs of organisations rather than actually responding to live issues that we see in the people we serve. And it also has placed all the values we kind of enshrined in our contract front and centre. So things like kindness, empathy, openness and trust. Everybody talks about that. Everybody is essentially demonstrating that. And it's been a really affirming, it's been really affirming for everybody, I think, the way this is right across the city is really kind of coming to the fore. Quite a lot of this we could have done at any time. I say could, I mean, I think small p politics would have made them very difficult to do. And COVID has actually enabled us to bypass quite a lot of that, what would have been lengthy negotiation and prototyping the process we would have adopted previously. It's really just kind of been swept away, but quite a lot of this we could have done at any time. And the other thing is this determination that we absolutely must not go back to the way things were. Even for us, who you know, we were doing this explicitly HLS way of working. There are lots of practices we must not go back to, I think. Thank you. Thanks, Mel.